Well, it is a delight to be here at the IOM again. We're very appreciative of the role that the IOM has played, particularly in the implementation of recommendations from the dietary guidelines as they apply to a number of the nutrition programs that we oversee. So I'm always both available and willing to come by to the IOM, and again, to say thank you for their support. Bill Dietz, when he finished his remarks earlier today, quoted a Winston Churchill expression. I thought he was going to use one of my favorite Winston Churchill isms, which is, Americans can usually be relied upon to do the right thing, but often only after they've tried everything else. And I'm not sure that's appropriate for today. I really want to say that the USDA and the Food and Nutrition Service in particular is strongly positioned these days to play a significant role in helping to reduce obesity in the country. And we heard earlier a citation about the reference to some promising trends in 18 or 19 states in childhood obesity. And CDC, when they released that report back some months ago, cited the WIC program, the Special Nutrition Program for Women, Infants, and Children. That program now serves 53% of all the infants in the United States, 75% of Hispanic infants, and 60% of all the infants in the state of California. So its reach is tremendous. That program is having a major effect on promoting more breastfeeding, particularly among lower-income women. And the implementation now, almost 3 years ago, of the new food package in the WIC program, more fruits and vegetables, whole grains, has definitely had an impact on WIC households across the country. There are about 9 million people each month that participate in WIC. So WIC is one example. We've heard references this afternoon as well to the Child and Adult Care Feeding Program, principally in child care, but it also has an adult component. But that serves about 3.5 million children in child care, about a third of all the children who attend child care each day. The program is growing by numbers incrementally at relatively small numbers, principally in the center-based programs. I worry about the erosion of and the loss of family child care homes that are in that program, that are related partly to reimbursement, but partly to the regulatory environment. School meals, we've heard references to that. Some 31 million children across the country in 100,000 public and private schools are now benefiting from a new meal pattern that was deployed last year. This is the second year of that program. And for the most part, the program has worked very well across the country. We had to tinker with 2 elements in it without changing the maximums for calories. And we finalized those 2 elements actually in a Federal Register publication just this past week. And beginning on July 1st of this year, 50+ million children, those who attend school across the U.S. from kindergarten to grade 12, will benefit by a much stronger total food environment because our so-called healthy snacks rule or competitive foods rule will now govern for all schools that participate in the National School Lunch or School Breakfast program. These regulations will obtain for all foods sold in schools during the school day. And again, we're very excited about that. And as was mentioned by an earlier speaker, those rules were finalized back in June, or filed, I should say. We're also looking forward and probing different alternatives in our SNAP program, the Supplemental Nutrition Assistance Program. We're very excited about, we had a test up in Massachusetts, our Healthy Incentive Pilot in Western Massachusetts, that demonstrated that if you create incentives, you can incent people to buy, low-income folks, to buy healthier foods. And we have variations on that theme underway currently in Texas through one of the major food chains where they're testing Many of us, certainly in the Washington area here, if you go to local supermarkets, you're likely to be part of an affinity program or a little card that you have to use if you want to obtain the benefits of their items on sale. Well, those store systems know a lot more about us than we realize. And in the case of several partnerships we have, one up in the upper Midwest and the other down in Texas, when folks use a SNAP or an electronic benefit card, that fact is going to generate additional coupons, for example, for produce or for whole grain breads, based on what the household is purchasing. We're very anxious to see the results of that as a way of, again, further incenting behaviors in the right direction. Now, we're also, I should talk about Let's Move. The First Lady, we wouldn't have a Healthy Hunger Free Kids Act enacted at the end of 2010 without the active advocacy and engagement of the First Lady and her staff. And that program is, was making a difference in the lives of students across the country. And we are seeing increased enrollments in our school breakfast programs. As many of you are aware, in this economy, we're seeing increases, particularly in the percentage of free and reduced price meals being served to students. Again, a reflection of the challenges that households are facing in the economy. Well, that meal program now deployed as part of the Healthy Hunger Free Kids Act provides fruits and vegetables every day of the week, something that was not the case in the past in school meals. More whole grains. The dairy is 1% or non-fat. There are calorie limits for the first time and in the history of the program. And increasingly, we're seeing schools in low-income areas. I was out at a middle school in Suitland, not too far from here, back about 6 weeks ago, where they're now serving suppers for an area of that county that has a very high density of very low-income families. And we know that can make a difference. The Fresh Fruits and Vegetables program, when I travel the country, I go to elementary schools that are part of our program, and many of those elementary schools participate in the Fresh Fruits and Vegetables program. One of the best things we do, really. And it is a way of both promoting healthier eating, but educating children to fruits and vegetables they might not otherwise be exposed to. We are promoters of something called a Healthier U.S. School Challenge. 6,500 American schools have voluntarily met a higher standard, both in terms of their activity, wellness policies, as well as their nutrition program. And most of those schools, when I've been out to them, their transition to the new meals pattern was almost seamless in terms of, because they had really been at this for several years. Where are we headed in the future? As I said, we believe SNAP, the Supplemental Nutrition Assistance Program, provides many opportunities for us. 47 million people are being served in the program each month. Nearly half are children. That high number being served reflects really what's going on in the American economy, as well as efforts states have made to provide better access to eligible families. We're now serving about 79% of the eligibles in the United States. Most of my career was in state government, when typically 50% of food stamp or SNAP eligibles were served. So more people are eligible because of income in the economy, but states are doing a better job of providing that access. I mentioned several states in passing that are providing pilots for us, but I want to focus in particular on SNAP education, or on the nutrition education program that we have. I was in a clinic earlier this week, and I was pleased to see the icon, My Plate, devised at the Center for Nutrition Policy. That center now gets 3 million folks across the United States that are signed up to visit on that website to receive direct advice about their diet, how they're doing. Well, I saw this in a clinic here in the district, in a clinic that serves low-income families, was pleased to see it. but also reminded of the power of the nutrition education program we have. SNAP-Ed is about $400 million nationally. It's one of the largest sources of nutrition education. And the Healthy Hunger-Free Kids Act made 2 amendments to it, and then I'll finish. One amendment was it said those funds have to gradually more closely reflect the number of consumers who receive benefits through the SNAP program. So gradually we're going to see some shift of funds from a small number of states right now to a much fuller number, a closer number of the 50-plus states and territories. But also the policy, as was mentioned by one of our speakers earlier, those funds can now be used in addition for classroom education or education to provider groups. They can be used for policy advocacy. This is a major change, and we're seeing more of that, particularly in our West Coast states. And we're hopeful we're going to spend time later this spring searching out states to encourage them to consider using those new funds that are coming their way in a policy advocacy way. As has been pointed out, that may be the surest way to really reach so many millions of people. My plate I mentioned. Finally, I should mention that we are, as we're meeting here today, I have my fingers crossed. We hope that folks up the other end of town here will act this week, or this month at least, on the Farm Bill, or the Food, Farm, and Jobs Bill as it's formally known. That's the underpinning of most of the nutrition programs that we operate, not all. And it's really important for stability, for planning, for adequacy of resources that a Farm Bill get passed. So thank you very much.